everybody talks about OCD, but there's also OCPD, which is obsessive compulsive personality disorder.
Hmm.
Can you tell me the difference between both of them?
So, OCD is a mental health condition. It can sometimes be a condition with a lot of disability because there are obsessions, there are intrusive thoughts, intrusive images, and there are often compulsions that one feels compelled to do something. One is able to see that there is no sense in doing this, but one feels compelled to do it and repeatedly do it. So, that can be a very difficult situation to be in, and it is a proper disorder, one with considerable disability. OCPD, on the other hand, is a personality disorder which is marked by perfectionism, so much perfectionism that the task completion goes for a toss at times. It is marked by people being workaholics, meaning very very devoted to their work, wanting everything their way, so they would not delegate the tasks, and if they delegate them it would only be if they can make sure that the other person would do it exactly their way. They would be miserly in their way of spending, very preoccupied with rules and details and order and organization. They would also have a tendency to not throw away things easily. So they would keep them collected even if they are worn out and useless. And there is also a rigidity and a stubbornness that they have. And another thing is that they may sometimes have OCD along with OCPD. That can happen, but that's not necessary.
But
So
they're
this
quite
is
similar, no?
that is a disorder. This is just a personality. This is just a very controlling kind of personality that wants everything their way, and they're very very conscientious as well. So having one or two traits of OCPD is actually not bad and can be pretty useful. But if that becomes problematic and if there is dysfunction involved, then that needs to be treated.
Got it. Um, but how do these, from what I'm understanding, Doc, these two things don't seem to be a massive problem like anxiety or depression or something. So do these?
OCD is more problematic than anxiety or depression.
It's more problematic. So how does? Can you give me an example in your clinic on how it manifests with different people?
So the problem with OCD, especially the more severe form of OCD, is that a lot of time goes into these obsessions and compulsions. And the level of impairment is such that they're completely unable to do things that they feel very obsessively about, because they know that the moment they start doing it, they will have to do it in a certain way. So someone with an a theme in OCD of, let's say, cleanliness and organization, can actually have a very dirty room. Why? Because they feel that if I sit
Hmm.
and try and organize this room and clean this room up, I would not know when to stop. So it can create a lot of disability in people. People can have actual excoriations and wounds on their hands just because they keep washing their hands repeatedly, or sometimes their body repeatedly when they go for a bath.
Can you give me some examples of like really bad OCDs? Because for most people, you think OCD, like I said, is a small thing.
Yeah.
You want to keep your slippers all in a row.
Right.
That's what people think. Or just like they're little ticks.
Yes.
But like you're saying, it's worse than anxiety, which is interesting for me. So
It can. And earlier it was counted, both PTSD and OCD were counted among anxiety and related disorders. Now, because the symptomatology is quite different and the treatment modalities are different, they are given distinct categories.
yeah.
So maybe, an example would help. There was this person who told me that they missed their entrance exam because for their OCD, they needed to polish their shoe a certain number of times. So they had to polish their shoe a certain number of times. Then they realized that there was a little dust on their shoe. So they again needed to polish it that many number of times. And in the process, they end up missing the bus. And after that, they tried to go taking a taxi. They reached late. They were unable to give the exam and they flunked the exam. So that is one example. Now, when I asked this person that this is something that happened very often, and they said yes, for a lot of things. They had to sometimes repeat exams, they had to sometimes let go of relationships, and sometimes they would have to buy things over and over again because the OCD demanded that.
Got
So
it.
they would buy, they would find that, this wasn't clean enough, they would try and clean it, destroy it, throw it, we'll need to buy it again. So that sort of thing can happen. Although most OCD themes are generally about, germs and cleanliness or about order, but they can be different types, there can be different themes in OCD. One particular theme which you would find quite problematic if you meet someone with that is constant reassurance seeking.
Hmm.
So they would ask you, okay, is this fine? Then after some time, they would ask you the same thing.
Hmm.
Then again, they would ask you the same thing. And then they would ask you the same thing in a roundabout manner.
Hmm.
And they would keep, finding you just to ask you the same thing
Hmm.
over hours and sometimes over days.
Hmm. Got it.